will start from the client point of view. So Dr. Klausner is a veterinarian, many, many years a veterinarian. I am a crazy cat lady, many, many years. So prior to coming to Banfield, I worked and lived in Philadelphia, had cats at home. I can tell you I took them to the veterinarian every 2 to 3 years. No veterinarian ever recommended dental, ever, for my cats. They never explained to me what was happening, and I was that client who went to the veterinarian when my cat was sick. I didn't understand I wasn't a good pet owner for doing that. They praised me when I came in, cat looks good, isn't gaining weight. Those were kind of the general conversations. And I remember the first conversation with a very funny veterinarian who worked at Banfield, whose communication style was maybe not exactly right for me, but she was very matter of fact. And I told her I'd gone into Banfield, and they told me that my cat Norton, who was the love of my life, my husband doesn't like to hear that, by the way. Can't help it. He's lovely. He wasn't Norton. He isn't Norton. But they told me that Norton needed a dental cleaning. And as a client, the thought of putting my cat under anesthesia scared the heck out of me. And I know that Banfield has amazing protocols. We measure every anesthetic death. We continue to improve our anesthesia protocol. And as a client, I was still incredibly afraid. And so I had the luxury of working in an office with 5 or 6 other veterinarians sitting around me. And I went up to one of the doctors and I said, help me understand, I'm very nervous about the anesthesia. Her first approach with me was, well, that's fine, Jeannine. You don't have to give your cat the dental cleaning. He'll just die from much more painful things. That didn't work. I still was afraid. The other veterinarian, who was much more my communication style, so understanding your client, she looked at me and she said, I understand. It's very scary. Anesthesia is very scary. But at Banfield, we have the best anesthesia protocol, and your cat has a 1 in 10,000 chance of dying. He has a 1 in 5 chance of getting heart disease, kidney failure, liver disease from leaving that bacteria in your pet's mouth. My cat was scheduled for that anesthesia 2 days later. It's all about communication and using the style that's right for your client. Was very funny because my husband, the doctor who said that's fine, he'll die from more painful things, that worked for him. I still wasn't convinced. So it does depend on your client. So as Jeffrey said, wellness plans are not just a product. For Banfield, they are the way we deliver preventive care. When I first started working at Banfield, I wouldn't say that was true. So the founder had an amazing vision for wellness plans. And he understood them and believed in them, but our doctors didn't necessarily believe. They did not have a preventive care mindset, and they just felt like they needed to sell something. It didn't really take off. Wellness plans, we've had them for a very long time, but the success of our wellness plans is really in the past 5 to 7 years because we spent a lot of time going back and re-educating our veterinarians about the importance of preventive care and that wellness plans are just a tool. It's not the wellness plan is the be-all, end-all. It's the way we deliver preventive care. As a client, they're wonderful. For me, it helps lay out the care that my pet needs for the year. I understand what I need to come in for. I understand what signs to look for. It makes it a much better experience for a client. It's very, very hard. I liken, I think Jeffrey said, the veterinarian's very much like the pediatrician. I can't tell you what's wrong with my cat. I just know he doesn't look good. So knowing the signs to look for and when I need to come in, it's incredibly helpful. So for me, it's about peace of mind. The other thing is it really reestablishes the role of the veterinarian, and we'll talk a little bit about how much more frequently the wellness plan clients come in. So it gives you the opportunity to build partnerships and create loyal clients. So Jeff talked about this, that preventive care helps the client see the value. It's critical that you constantly educate. And we'll talk a little bit about how you design the plans. And what's difficult is how clients define preventive care is often different from how veterinarians define preventive care. And we'll talk a little bit about the example of nutrition. Wellness plans really just remove a barrier. It's about giving them an easy way to know when they should come into the client, provide them convenience, and a schedule for when they should get the services that they need to receive. And then affordability. We've looked at our clients across all demographics, from the poorest families to the wealthiest families that come to Banfield, and they all say the same thing: I want value for my money. It doesn't matter how much money you make, you want to make sure you're not wasting money. So having it be affordable is a critical piece. And part of that affordability can purely be a way to plan for the dollars you're spending. So you don't need deep, deep discounts. When I first started, the wellness plans were discounted 60 to 70%. Over the years, we've raised that. They're discounted between around 40%, and some of the services in the plan is only discounted at 10%. So it's increasingly gotten more affordable. But for the client, being able to pay for it every month makes a huge difference because they can plan for it in the budget. The wellness plan drives additional visits. If you look in the first year, a wellness plan client on their first year of their plan comes in an average of 6 times. In year 2 and forward, they come in 3.5 times. That number this year has actually increased to 4, so it's at a flat 4 visits per year. Our non-wellness plan clients are coming in 1.5 times, and that's pretty much consistent over the life of their pet. And this is the difference it makes for the revenue. We compare Banfield to the veterinary profession. The profession has been flat to declining. If you take out price increases, the line is going down for the veterinary profession in the US. And Banfield has been growing, and the gap is getting bigger. And frankly, this is not a good slide for Banfield. It's wonderful that our business is thriving, but if the profession fails, Banfield fails with it. If clients continue to not believe there's value in coming into the veterinarian, our job gets harder and harder and harder. It's why Jeff and I are happy to come and talk about preventive care and wellness plans in other countries. Jeff talks a lot in the US. We've actually partnered with the AVMA and provided them with tools to be able to give to other veterinarians to do wellness plans in their practice. If the industry fails, Banfield fails with it. So this chart is wonderful for us and really, really scary for us as well. Probably more scary, shockingly. So we'll talk a little bit about practical ways to consider designing wellness plans. Now I know when I was in South Africa, we talked about this, and the veterinarians were very skeptical. And one of the things they said was, it's easy for you to do this because you have 800 hospitals, you have a big machine. And I agree and I disagree. So what is easy is we have the systems that make it easier to do the back end of the wellness plan. That is going to be the hardest thing for a small practitioner to do. But what is harder for Banfield is we have 14,000 associates, 3,000 veterinarians. Think about your practice. Think about the 3 or 4 or 5 veterinarians who work with you. Do you all think alike? Do you all believe in preventive care? What is your level on the spectrum of comfort in educating your clients? Now take that across 3,000 veterinarians, 14,000 associates. It's very, very hard. There are really 5 key steps in thinking about the wellness plan development. The first one, Jeffrey spoke about it, and it is the most critical one, and it's changing the mindset of your teams. It's you as the leader in the hospital. I think we actually kicked off the conference. There was a slide that talked about what you needed to do to be a leader, and it talked about being able to communicate mission and value, your mission and vision, to be able to shift the mindset of your teams. That is critical in order to have wellness plans. If your team does not believe and you build a wellness plan, They will not be successful. I can promise you there were many years for Banfield where wellness plans were not successful. Critical to changing that mindset is aligning around the medicine, and we'll go into some details of some of the things you need to think about when you're doing that. The easiest part is actually creating the plan. Jeff likes to remind me because that's my job. So I get to create the actual wellness plans. He says his job is much harder than mine. Sadly, he's probably right. So number 3 is very easy. Number 4 is creating pricing that works for you, but the big and is it must work for your client as well. And number 5 is train your staff. So getting your teams on board, because for a client, every time they walk into the hospital and the front desk person says one thing, and a vet technician says something else, and then the veterinarian says something else entirely, it's harder and harder for the client to understand that value. You want to make sure your message is consistent throughout the hospital. So creating the preventive care mindset, that's the first step. The whole team has to be bought in. So one of the mistakes we made at Banfield, we didn't think about the person at the front desk. We really got our doctors on board, but we kind of forgot about the person who does the greeting. And in our hospitals, we're very busy, very big hospitals. The front desk person spends the most time with the client. They actually have the most time to interact with that client and help educate that client. So if you leave them out of the equation, you're missing a huge opportunity for education. So Jeff talked about SIA. You have to make sure your teams are not thinking that way, thinking beyond SIA. We actually have a report that prints out at the end of the visit that says, what did we do today? So what did we do today? So it can include, we had vaccinations, we did a dental cleaning, what you should be looking for. So helping your client understand, here are some things you might want to watch at home. So your pet might start to get sick from the anesthesia, whatever it may be. You can see I'm not the doctor. And then the last part is what's next. So when do we need to see you again? What's next in our conversation? If there was something that was found today that we need to continue and follow up with in 3 weeks, we make sure that's there. So it's a very consistent approach. What did we do today? What should you look for when you take your pet home? And then what's next? Generate excitement around wellness. One of the things Dr. Klausner did when he joined Banfield, and it was really quite brilliant, I don't like to tell him, is to share stories of success. When you think you went to vet school and when you talk to veterinarians, oftentimes the thing they get excited about is I had this amazing case and I was able to diagnose disease. And they're proud of what they found and what they were able to do with that pet. They don't get excited about I had a pet in, they got vaccines, pet's healthy. And so frankly, for the consumer, that is exactly what I want you to tell me. I want you to give me a report card that says I'm doing an amazing job keeping my pet healthy and not needing any kind of sick pet care. And it's a big disconnect for the veterinarian. So it's important to start telling stories about the success of wellness plans, the success of preventive care. Now I will say my cat Norton, the love of my life, lived until 19. He lived until 19, I am convinced, because he was on the wellness plan from the time he was 7. He got a dental cleaning every year. We caught some things with him very early on that allowed him to continue to live long and healthy. Sadly, my worst fear of the anesthesia, during a dental cleaning, he did not die under anesthesia, but they did find a squamous cell carcinoma. And he did live about 9 months after that, but it was not long. It's a pretty quick acting. But to me, I believe in our wellness plans because I believe Norton made it to 19 because he was on that plan. And then another piece is really making sure your incentives. So if you pay your doctors or your teams based on productivity, so in the US, doctors are paid on production. One of the things we found is some of our pay scale was off. They weren't making enough money on the preventive care visits. They made more money doing surgeries and anesthesia. So truthfully, are they going to be motivated to deliver wellness if we're not paying them appropriately? So that was part of the wellness plans were discounted too deeply. So part of it was increasing the value of the wellness plans so that the doctors could actually earn the right amount of money. And that's a critical piece, because if you're not paying them or your teams for the wellness visits, you're demotivating what you're trying to change. So don't make the same mistake we did. So this is our preventive care model: dental care, parasite control, nutrition, vaccination, and behavior. And probably the two that are surprising are nutrition and behavior. And frankly, when we first talked about wellness, we didn't have them in the equation. And the sad part is we did exactly what we're preaching to you not to do, which is we forgot about the client. So as veterinarians, dental care, parasites, vaccinations, that makes sense. But nutrition is hard. Doctors aren't taught in school about nutrition. But here's the startling fact: 80% of all clients want a nutrition recommendation from their veterinarian. 80%. Does anybody want to guess what percent of the clients that we talked to when we surveyed said they got a nutrition recommendation from the veterinarian? Anybody want to venture a number? How about we raise our 50%? Anybody think greater than 50%? He said 0, 5, pretty good. About 7. So 7% of the clients. 80% want one, 7% got one. The ironic thing is when we asked our veterinarians, what percent of the time do you believe you're giving a nutrition recommendation? They said 60%. So the doctor actually believes they're talking about nutrition, but generally the conversation goes something like this. Hey doc, I don't know what to feed my pet. And they say, what food are you feeding? And the client says, Royal Canin, I'm sure. And then the veterinarian goes, that's a good diet. That's the idea of a recommendation. And even though in there, so it's a very, very big disconnect. So it was important for us to put it at the forefront of our preventive care. And the same thing for behavior, because that is what affects their relationship with their pet every day. So I adopted a kitten. I will now tell you that I forgot how insane it is to have a kitten, because my other cat is now 15. And she's old, and she's slow, and she's lovely. My kitten bites me, scratches, runs all over things, jumps on things she's not supposed to. Behavior matters. Being able to go in and talk to my vet and say, how do I stop the biting? Unfortunately, the answer, and it is always the answer, is it was my fault, right? Because I played with him with my hand, hence he bit my hand. But it still was good to have the conversation to realize how important it is to reinforce that behavior with the cat, and playing with him and rubbing his belly while he was attacking me with his claws was not a good way to reinforce positive behavior. So aligning around the medicine, like I said, we have 2,900 veterinarians now, Jeff. That's a lot of people to get on the same path. So what we found was easiest is really trying to go with the national practice standards. So we really worked with AHA and AVMA to look at their best practices and aligned our wellness plans around those. When I first started at Banfield, we had our own protocols. We did not follow the guidelines of the industry. It made it really, really hard to bring on new veterinarians to explain why we were different. There were some where we stayed different, but the majority of the things we aligned with the profession. It made it easier for us to be a bigger part of the profession, much easier to recruit doctors and bring them on board, also easier to get 3,000 doctors to align around something that is nationally recognized. So as I said, this is my job, and this is the easiest part. So most practices offer between 3 to 5 plans for dogs and cats. It doesn't have to be that many. The number one selling plan at Banfield are the puppy kitten plans. Start with puppies and kittens. People know they need to come in. It's a great time to build that bond with the client. What we see in the US is lots of people get veterinary care for those puppies and kittens and then fall off and don't come back to the veterinarian again for 3 to 4 years. So getting them on a wellness plan early and then keeping them on a wellness plan is a great way to kind of forge them to your practice and build that partnership. Plans can vary. You can do, we right now have basically a juvenile plan, an adult plan, and a senior plan. That senior plan, we don't determine that by age because obviously every pet ages differently. So it's really health condition. So some young pets can be on what's considered a senior or more advanced care because they're just a less healthy pet. But if you're starting out, start on the juvenile side. It's our most successful plan, highest satisfaction with our clients, and a great way to get them connected to your practice early. It is harder, the more plans you offer, the harder it gets to actually manage the back end of that. So a lot of questions come around the office visit. So at Banfield, we offer unlimited free visits. So you never pay an office visit once you enroll in a wellness plan. I would not recommend that when you're starting. We have an amazing system. We can track how many times our clients are coming in. We can adjust our wellness plan pricing and our office fit pricing to make sure that's profitable for Banfield. I think that would be very, very hard to do for a small animal practitioner. Truthfully, once a year, twice a year. So whatever you're aligning your medicine to, if you're saying every 2 visits per year, you can make those 2 visits free for those 2 comprehensive visits. And then if they come in for sick pet care or other times during the year, but it can be very hard to start with unlimited office visits. We strongly believe in the more office visits you give them, the more they're actually going to use it. And I'll give you some data. Today, about 85% of Banfield's revenue comes from our wellness plan customers, but only 40% of it comes from inside the wellness plan. The other 60% is for every visit that they come in and get additional care. So it more than pays for the unlimited free office visits to have them come in 4 or 5 times a year. Because truly, clients have limited budgets. They plan whether they communicate to you, I'm not going to spend more than this, or they have in the back of the mind how much they're going to be able to spend. When they feel like they're getting a really good value on the care that they have to receive, they're more willing to take your recommendation on the additional care. So we did focus groups last year, and there was a 13-year wellness plan client. So she'd been with Banfield, actually all the time that I have been with Banfield. And she had a great quote. She said, I realize I spend a lot of money with Banfield. I probably don't save that much. But what I do know is that my wellness plan makes the care that my pet has to receive affordable, so I can afford to get the care that helps my pet live a longer life. I wish I'd had a tape recorder because I could have used that. In designing the plan, you want to think about those core things that every pet needs. Those should be included on the plan. So examination once or twice a year. We strongly believe in two visits per year. Vaccines, parasite control is a big one. A lot of the states in the US have challenges with heartworm and flea tick. CBC, chem profile, urinalysis, blood work, whatever once a year, twice a year diagnostics you want to run on that pet. Our puppy and kitten plans include a spay-neuter surgery. That's optional. It's a very big area of competition in the US because shelters have gotten into spaying and neutering the pets, so it's very competitive. So keeping that very affordable was critical in the US. I'm not sure what the environment is Spain, probably similar. Yeah. Similar, yeah. Dental cleaning. So we have plans that include dental cleaning and ones without. So depending on the pet and the health of the pet and the age of the pet. That's a competitive advantage for Banfield. Dental cleanings in the US are very expensive. We believe strongly that the pet needs those every year, so we've chosen to include them in the wellness plan. Again, that may not be where I would start without data to be able to really understand, are you making money on that with it if you give that at a discount? You need to focus on service versus product, which I think in Spain is easy because most of the products are not there anymore, right? So you have to focus on services. But I think the key to remember is this: wellness plans are a vehicle to bring your clients back into your hospital. So if you build the plan, but then you don't actually communicate with your clients, they won't work either. So if your team doesn't believe and you don't communicate with your clients about coming back in, the wellness plans will not work. And I know Royal Canin has some amazing programs, I believe they're doing in Spain with email to try to drive clients back into the hospital. Utilize those services. Lots of the pharmaceutical companies offer it. Whatever you can do, make sure you're talking to the clients and getting them back into the hospital. So this is hard. Pricing is a really, really tough subject in the veterinary community, but you have to be able to remove a perceived barrier. This data came out of a Bayer study that was done in 2011. They just redid the data, and sadly this has gotten worse instead of better. But clients answered, the cat owners are in orange, the dog owners are in blue. What would it take for them to visit the pet, to bring their pet to the vet more often? 55% of cat owners answered if it was less expensive. 48% of dog owners. On the good side for wellness and preventive care, 55% of cat owners said, if I knew I could prevent a problem and expensive treatment later. So if you have wellness and you focus on preventive care, you can overcome the barrier of the expense. Dr. Klausner spoke about the importance of good communication skills. As veterinarians, you guys so underestimate your value. As a client, you guys are my heroes. Crazy cat lady, you keep my cat healthy. You need to help your clients understand that value that you're bringing on that visit. And if one of those ways is making some of those services affordable, or even breaking it into monthly payments or quarterly payments so they can spread their payment out, they will better understand and accept the additional treatment if they feel like they're getting good value for their money. And it isn't about low cost. Banfield is not the lowest cost veterinarian, despite our buying power. We have certain areas, certain things where we price ourselves the lowest in the market, or close, I would say a little lower than our competition. That is flea tick medication, heartworm medication, because our competition is not the veterinarians in our market. It's Costco and Target and PetMed Express. So we're competing with big players. Our services are priced at the prices of the other veterinarians in the market. So we do not discount our services to the point where we're so much lower than the rest of the profession. There's two reasons for that. One is our commitment to the profession. We don't want to gain our clients on the backs of the other veterinarians in the marketplace. And the second is that other chart that I said, it looks like all happy for Banfield at 25% growth. But the truth is, if we lower our prices and underprice other veterinarians, all we do is continue the decline for the remaining veterinarians, and that's not a winning proposition for Banfield. But what we do is make sure those core services that we believe every pet should get every year are affordable, and they're inside the plan so they can pay for it over the 12 months. So where do you start? You start with your current retail pricing. So take what you're charging your other clients, put all of the things you think the pet should get for that year, price it all together, and give it a 10% discount. Start at 10%. Just say we're going to reduce it a little and allow your client to pay for it over once a quarter, ideally every 12 months, once a month. You want to remember you're driving more visits. So the point is, if they come in and they feel they're getting savings, they tend to buy additional services. I can honestly say I have yet to leave a Banfield in my 13 years without having a bill that ranged in the, $100 to $200 range, and I get a free wellness plan as an employee of Banfield. So I certainly spend an awful lot on top of my wellness plan. The key is to be mindful of the competition, both veterinarians and the retail competitors. So in those areas where you're competing, so for Banfield, it's the flea, tick, and heartworm. It's the ongoing medication, so Rimadyl. People price shop Rimadyl if they're on it for long-term pain management or chronic arthritis. So those products we discount more because our competition isn't the veterinarian, it's the big chains. The real key, though, is giving them options for how to pay for it. The discount is less important. It's about giving them a way to plan for their care. So what we find, and that's incredibly important in some of your lower income areas. So for Banfield, we have hospitals all over the United States, many of them in very poor areas of the state. So we have hospitals in some of the most, probably lowest income areas in Texas, Mississippi, and Arkansas that are incredibly successful practices. And what our clients say in those areas is the ability to pay for that care monthly allows them to plan for it, and they budget for it every month. And they feel good because they're providing the care to their pet, but they can budget for it and it doesn't catch their family by surprise. We had an amazing story from a client in Arkansas who talked about the fact that she always felt before Banfield that she was making choices between feeding her children and feeding her pet. And so she chose her kids, probably the right choice, but she never felt that. She felt like she was a bad pet owner. And being able to come to Banfield and receive the care. Now, she doesn't spend, like I do, $100 or $200 outside of her wellness plan, but she does get the services she needs, and she plans it and spends it over that monthly period. So number 5 is the hardest. So this is training your staff. I was having a conversation with Sabina in the car, and she said that is the hardest thing for her. One of my funniest conversations with a veterinarian when I first started working at Banfield. So I grew up in the business world. My parents sometimes look at me. I went to Cornell to study hotel management and marketing, and somehow I'm in veterinary medicine. And it doesn't quite connect. But I had this conversation with the doctor who said to me, well, I don't understand. When I work at the hospital, I just tell people to do things and they do it. I don't know how to change their behavior. I just tell them this is what you need to do and they go off and do it. And I giggled because I thought, in marketing, I can't tell anybody to do anything. Nobody listens to me. So it's all about influencing people and changing behavior. But it isn't a skill that every veterinarian has. So the staff training can be the hardest. The key is involve them early. Bring them into the conversation around what you're thinking about doing. What do you think should be included on the plan? How do you think we should design this? What are the biggest things you're hearing from your clients? The more involved they'll feel, the more invested they're going to feel in the success of those plans. Have clear roles and responsibilities. Oftentimes in our hospitals, the veterinarians didn't want to talk about the wellness plans. What they would tell us, well, that's the paraprofessional's job. She's supposed to sell that. Or the person at the front desk is supposed to sell that. The truth is, if my doctor doesn't tell me why I need a wellness plan, nobody else is going to be able to sell me a wellness plan. I might buy it because I felt like, well, I guess it's a good deal, but I'm not going to feel good about it. And I certainly won't stay on the plan. But if my doctor says this is what you need, much more likely that I'm going to buy the plan and stay on the plan. Train early and often. So you want to make sure you're re-educating after they've been out for a few months. How are they working? Do you feel like they're successful? What are your clients saying? Going back to celebrating. Celebrate the wellness stories. What did you find on that exam? How happy was your client when they walked out with a clean bill of health? And then provide free plans for your associates if you can. So it's a way to get them used to what does it mean? What does it mean to be on a wellness plan? What's included? So they really fully understand. So there are things you should be very careful of. We've talked about a few of them throughout the presentation. These are the other big ones. Your team must believe. If they feel like you're just telling them to do something, they probably won't do a great job explaining it to their clients. Insurance versus wellness. So in the US, and I don't know how it is here in Spain, in the US, insurance on the healthcare side for humans, while it's a mess, we're used to it covering everything. So when I go to the doctor, I pay the bill, it's a deductible, I pay $10, everything else is covered. It's important that your clients understand this is not insurance. This is, in fact, a package of services. They're only going to receive the things that are included in that package. We have a huge problem with that at Banfield, where people think I bought insurance and everything's covered, and that can lead to big disconnects with the client saying, well, I thought this was covered, why do I have a $100 bill? The communication strategy is key, and I can't underestimate this. Utilize your partners. Bayer has an amazing communication program, Zoetis, Royal Canin. They all have programs that can help you talk to the client more frequently. You need to get your clients into the hospital to actually use services. If they have a plan but they don't use the services, they generally won't stay on the plan. It'll be a very bad experience. So we talked a little about unlimited free office visits. Another area is, who do you allow your teams to enroll? So at Banfield, we do not put any limits, except the pet needs to be healthy enough to live a year, because you're planning for a year, so you don't want a pet that it's on its maybe last few weeks of life to sign up on a wellness plan, and then that's no good. I will say, to start out, I would put a policy of enrolling healthy pets. It's easier. If you're really trying to build a mindset of preventive care in your practice, enrolling sick pets sends a mixed message to your hospital. What ends up happening is your teams start to believe this is just a way to discount our services, instead of this is about the right preventive care for the pet. Now at Banfield, we're able to do it with sick pets. At this point, it still causes confusion. It still can be confusing for our teams. So I would say start with healthy pets, start with puppy kittens, start with 1 to 2 visits per year for free, included in the plan. And then the part that's hardest, and I know we were talking a little bit, there's not really anyone in Spain yet that does administration of wellness plans. There's a few practices, I think, speaking today, that are looking at that. That is the hardest part. So the back-end administration of it, if you start small with just a juvenile plan and you really you can track it in Excel, you can do anything in a small form, but really make sure you're understanding what services people are receiving and how much money you're collecting. So those are the two balances. You don't want to be on the flip side of profitability. So that can be very challenging. So focusing a little bit more on the communication aspect, the client education is both in the hospital and at home. So 2 really important keys is ensure that your marketing message is exactly the same as the medicine message that you're giving in the hospital. And you want to make sure your teams believe first. So we had a bit of a problem maybe 2 years ago. We started a war on heartworm because the heartworm disease was rising in the US. Clients were coming in less and less for heartworm prevention. And being a marketing person, I was very enthusiastic and thought every client should know how dangerous heartworm disease is and they need to protect their pet every month for 12 months. And we sent a mailing out to, probably close to 500,000 pet owners. The big problem was our doctors in our hospitals didn't necessarily believe that every pet needed to be on heartworm 12 months of the year. So we had clients walking in with a postcard to our hospital saying, I need to buy this for my cat or dog. and the doctor saying, no, you don't need that. So 2 problems. One is disconnect between marketing and medicine. Angry client going, why did you mail me this? Lots of money to do the mailing. So the key is make sure your teams and medicine is on board and that you communicate the same message that you're sharing in the hospital, because it's very disconcerting for a client to get one message from the doctor and a very different message from corporate. And then create communication expectations within your whole team. What is the role of the front desk person in educating and communicating? As Dr. Klausner said, one of the best ways to start is just make sure that each member of your team asks the client, did you understand the doctor's recommendation? Do you have any additional questions? Seems so easy. Doesn't happen a lot of the time. So, my very first visit to Banfield was with my cat Winnie, not Norton. So Winnie had been gaining weight. She seemed to be drinking a lot of water, didn't look good. And I took her in, and she had diabetes. They diagnosed she has diabetes. And my interaction with the doctor, I'm pretty sure the doctor was talking to me, and I'm pretty sure I was not listening, because in my head I went, my cat has diabetes. How long is my cat going to live? Does that mean I have to give my cat shots? Can I give my cat shots? Will I be able to do that? I don't think I can give my cat a shot. I had a whole conversation going inside my head, and I'm pretty sure the doctor was doing this, and I'm pretty sure I was nodding my head to her. And she left the room, and I thought to myself, I have no idea what she just said to me. And the nurse came in, and she said, did you understand what the doctor said? And I said, absolutely not. I said, I heard diabetes. Does my cat have diabetes? And it was, and she laughed and brought the doctor back in, who talked a lot slower and paused between conversations. And it was my fault, because I'm pretty sure I was doing this the whole time. Yep. Oh my God, And then it was wonderful. He came back into the room, and I waited a few minutes, showed me how to give insulin, made me practice on an orange, did all of these wonderful things. But had I not, had that nurse not said to me, did you understand what the doctor said? I would have walked out, paid my bill, and gotten home and thought, oh my God, what am I going to do? Yeah. So I think Jeffrey's going to join me back on stage, and so if you have questions for either of us.
And maybe before we get to questions, I just want to summarize just a few things for you to keep in mind here, and to give you some summary thoughts, and hopefully they'll stimulate some questions. So the first thing, and again, both Jeannine and I have emphasized this for the last hour and a half, is if you want to change your practice, and it's up to you, it's your choice. You have to make this choice. You can become a preventive care advocate, but it's a choice. You can go on and just mainly practice reactive medicine and wait for people to come in when their pets are sick, or you can become a preventive care advocate. Preventive care, as Jeannine already said, can actually be a bit boring. How many normal dogs do you see every day? How many normal physical exams? But remember what it's like to have your own pet when you brought your pet to a veterinarian, or maybe more relevant, when you brought a child or a grandchild to a physician, and they complimented you on the preventive care that you've provided. Think how good you felt when your physician said, boy, your child is doing great. Weight is good and everything is just fine. You're doing a great job. How many of you have complimented your clients on the great job that they're doing with preventive care? How many of you compliment your clients and remind them that, boy, great job on cleaning those teeth. You're really helping to prevent lots of disease. So that's part of becoming a preventive care advocate. It's getting excited about preventive care. It's getting as excited as your clients are about preventive care. Then I want to emphasize, Jeannine was really good at this, I want to emphasize again the importance of collecting stories. You have to educate your clients about prevention. And the best way to do that is with stories. So I'm going to give you, before we do questions, I'm just going to give you a couple more stories. Jeannine gave some great personal experiences. Just a couple more quick stories. One's about heartworm disease in the U.S. There was a client who came into one of our Banfield hospitals, and they had been coming in every 3 years and had been taking home heartworm prevention. And now it was the 3rd year that the client came into the hospital. And the poor dog actually had heartworm disease. And the veterinarian was perplexed. He asked himself, what went wrong? And then he asked the client, I've talked to you about heartworm prevention every 3 years. I've given you the medication. What went wrong? How did we end up with heartworm in your dog? And you know what that client said? He said, Doc, you just didn't tell me hard enough. Doc, you didn't tell me hard enough. How many times do we tell our clients hard enough about flea protection, about internal parasite control, about infectious disease control? Or do we just go through our usual spiel and try to get the words out as fast as we can so we can get on to the next case? Have we told them hard enough? Have we told them hard enough that they will actually do what we've recommended? Then another story is maybe a brighter story, just an example of what preventive dentistry can do. One of our hospitals in New Jersey saw a 3-year-old dog, young dog, happy and healthy, no problems. Owner hadn't seen anything. Dog was on a Banfield wellness plan. Came in to have the teeth cleaned. And while the technician was cleaning the teeth, she noticed a very small tumor in the back of the dog's mouth. The owner agreed to have it biopsied. It was a squamous cell carcinoma. It was the size, less than the size of a dime. To make the long story short, surgery was done, the tumor was removed, and the dog is now living a happy, healthy life. Most of you have seen, how many of you have seen oral tumors? How many of you have seen tumors in the mouth of dogs or cats? Everybody just about, right? How many of you have ever seen one that was the size of a dime? Most don't. Most of the time, you only see the tumors when they're very large and very hard to treat. That's the importance of preventive care. Those are the kind of stories you want to collect. Those are the kind of stories you want to talk to your teams about. And then you want to get scripts. You want to have your teams have some consistency in how they talk to clients. You need to explain each and every time to new clients why vaccination is important. Again, after you've done it 5 times during the day, it's boring. I'm tired. I don't want to do this again. But for the client, it's the first time. And so you want to talk to your teams about the scripts that they use, the words that they use, so that they're consistent. It is about a choice. And we'll end this in just a minute. It's a choice that you can make. I can guarantee you from what I've seen at Banfield in the 5.5 years that I've led the medical practice at Banfield, that it will make a huge difference in your practice. But you have to change the way you practice. You have to slow down. You have to talk more clearly. And you have to make the client the center. You truly have to have a client-centric practice. And then if you add wellness plans to a client-centric practice where you focus on prevention, I can guarantee you, I can look at each one of you in the eye, and I will bet a year from now, a year and a half from now, 2 years from now, You will be amazed at the amount of new revenue you have in your practice and how much new profits you have. So I want to thank you on behalf of Jeannine and I again for the invitation to come to Spain, and we'd like to take lots of questions, either the practical or, as Jeannine said, the impractical, which is my role. Thank you so much.
Bueno, vamos a hacer el turno de preguntas, ¿vale? Han acabado bien de tiempo, con lo cual es perfecto porque podremos aprovechar para hacer más preguntas. Thank you very much, Jeffrey, Jeannine. Bueno, adelante, levantáis la mano si os pasamos el micro. Por aquí, después.
Sí, muchas gracias por todo lo que nos llevamos sobre prevención. Yo quería hacer una pregunta concreta. ¿Tienen datos de clientes, de número de planes, de programas y económicos cuando se podía cobrar al contado y cuando han hecho un fraccionamiento de pago mensual?
So just to ensure I've got the questions, the difference with client acceptance when they had to pay cash versus the client acceptance when we introduced the monthly plans. Is that right? Yes. So we have a field in our system that is, we can mark client declines. So it means the client declines the service, whether that's from they don't believe in the service or they may not be able to afford it. I can't distinguish which way. But non-wellness plan clients, the client declined is probably 42% of the time they decline the service. For wellness plan clients, they only decline 10% of the time. So it's a pretty good indicator of the willingness to accept the recommendation. For the things that are covered inside the plan, 80% of those services are delivered. So vaccinations and dental care and parasite control, those things are delivered through the plan, so they pay for them. In terms of clients stopping payment on their wellness plan, that does happen. So we'll have some clients who come in who receive services and then try to cancel their plan or not pay their bill. We don't have that. It's probably 10% of the time where that happens, and we are able to collect that after. So you want to have a good banking partner who can help you with that piece, but it is something to look out for. It's why it's important to understand what services have been delivered and what money has been paid. But it's a small percent. The majority of the people pay their bill. Does that answer the question? No?
Yo decía la aceptación de programas preventivos cuando se hace un pago al contado o cuando ese mismo plan se hace un fraccionamiento de pago.
Yes. So preventive care treatment, so the preventive care recommendations with the wellness plan, very significant, 80%. Non-wellness plan customers, so those that are paying cash or coming in or prior to the wellness plan, only about 30%. Is that right?
Do you have monthly, do you all have them all on monthly basis?
We have both, you can pay once, so yearly or monthly.
Buenas tardes. En primer lugar, felicidades por la presentación, gracias. Tengo una doble pregunta. La primera sería, ¿quién debe comunicar el plan a los clientes? ¿Si tiene que ser todo el equipo o tiene que haber personas especializadas en la comunicación? Y la segunda pregunta sería, ¿cuál es el mejor momento de la venta? ¿Si tiene que ser en la consulta o tiene que ser en momentos de tiempos de espera, en sala de espera? ¿Cuál es el mejor momento para vender los planes dentro de la clínica?
So I'll start with that one. So who should communicate the plan? And I think we at Banfield have very strong feelings about that. It should be everyone. Everyone. But it's communicated differently. When a client walks up to the front desk at Banfield, if they're not on a wellness plan, we expect the receptionist to at least introduce the idea of a wellness plan. Hi, it's your first time at Banfield. Really glad you're here. I know that keeping your pet healthy is really important to you, and we have wellness plans. Now the doctor and the technician are going to explain more about it, but I'm going to give you a handout here. Just keep this with you. You have a few minutes. Take a look at this before you see the doctor while you're waiting. Doctor comes in the room with the technician, and then reinforces what the receptionist said. Starts to talk about the pet, maybe what the current problem is, but then starts to talk about prevention. And usually, the best question to ask is, what's your goal for your pet, especially if it's a new pet? My goal is, I want my pet to live a long, happy, healthy life. Well, I'm so glad you came to Banfield, because we're a practice that does prevention, and that's our goal. So our goals are aligned, and the best way for your pet to live a long, happy, healthy life is to be on a wellness plan. And that's because it allows you to come in frequently without having additional cost. You can come in, you'll come in at least twice a year, but you may come in more than that. And it gives us a chance to do a physical examination and have a discussion with you on every visit about what we're worried about and what we're thinking about. Does that make sense to you? Did you understand that? And that's a little bit how that discussion goes.
And the point I would add is someone who knows communication well can design scripting for training your teams. So you do want to have a consistent message. So getting that scripting in place and maybe a handout or flyer for the client so you ensure that the message is communicated correctly. But Jeff is right, it needs to be every point of contact within the hospital.
And at the end of the day, I really believe that if your team members don't believe in the wellness plan, if they think it's too expensive, if they think it really doesn't provide value, it won't work in your hospitals. So before you can even think about who's going to talk about the wellness plan, you have to have team meetings to start thinking about the wellness plan itself. And that's where the stories become important. The stories like Jeannine told, where her cat lived a lot longer because it was on a wellness plan. You can't force people to believe, but hopefully you can capture their minds and their hearts just the way we're trying to capture your minds and hearts today.
Buenas tardes. Gracias por las presentaciones, yo creo que muy interesantes y prácticas. Y bueno, Jordi, la verdad es que me ha chafado la pregunta en parte. Yo quería preguntar sobre el tema del plan de comunicación. Es importante tener unos buenos planes de salud, pero igualmente importante es comunicarlos a los clientes. Un poco por la respuesta a la pregunta anterior, he entendido que básicamente es cuando el cliente va a vuestras clínicas, cuando informáis de los planes de salud. ¿Tenéis algún otro plan más amplio, redes, lo que no es físicamente, etcétera? Y una segunda pregunta está relacionada con la valoración de los planes por parte de los clientes. ¿Hacéis algún tipo de encuesta de valoración clientes que tienen planes de salud versus los que no los tienen? Y los que no los tienen, ¿sabéis por qué no los tienen? ¿Es porque ellos no ven el valor o es porque el equipo no los transmite adecuadamente? ¿Cómo podemos mejorar ahí?
Three questions. Okay. Okay. So first, yes, we have a very robust communication strategy outside of the hospital. While we expect and hope that our teams do a spectacular job, we also know that doesn't always happen. Banfield has a very large web presence. We utilize social media. Social media is wonderful. It is hard for Banfield, right, because we have 850 hospitals, so client experience is this. Some days we're not so happy clients, so you have to be prepared for when you open up to those social media channels, being able to respond when you have a client complaint. So don't turn it on without being prepared to respond, because that can be not a good thing. But we have quarterly campaigns that go to our clients that reinforce, educate around dental care, parasites, nutrition, and wellness plans. So we have a very robust system. We send vaccine reminders, and for wellness plan customers, we send twice-a-year reminders that they're due for their twice-a-year visit. So yes, lots of communication and reinforcement of what's said in the hospital. That was the first one. The second question, do we survey our wellness plan clients to understand their happiness and satisfaction? So yes, we have a client experience survey that we do that surveys all of our customers on the experience in the hospital. So did you have a good visit? Were you happy? There's a lot of questions. Takes about 7 minutes to answer it. And we measure satisfaction of wellness plan customers and non-wellness plan customers. We have generally higher satisfaction with our wellness plan customers, not surprising. And yes, we do survey why they're on the plan versus why we're not. So wellness plan customers tend to be on the plan because their veterinarian recommended it. So those that are not, there are two main reasons at Banfield. One of them is that we are unique in the hours of operation, so we're open longer hours than a lot of other veterinarians. So we're open Saturdays and Sundays, and we're open till 7, 8 o'clock. So for many clients, Banfield is their second veterinarian. So they have another veterinarian and they come to Banfield when they can't get into their vet. So those people tend not to sign up on the wellness plan, makes sense. The second is they didn't understand. Nobody communicated the value. So it is a communicates at the veterinarian. They didn't recommend it, the team didn't recommend it. Yeah, and then there are a few clients that simply can't afford that, right? They're coming in just for their rabies vaccine and maybe a few additional services, and even spreading it out over a monthly payment, they just can't afford it. So there is a portion that can't afford as well.
Hola, buenas tardes. Dos preguntas. Una era, ¿por qué sugiere delimitar o acotar el número de visitas que incluye el plan en 3 o 4 solo al año? Y el otro, ¿por qué es un 10% el descuento frente al precio habitual?
Yeah, so our plans today are unlimited office visits. My recommendation to start with 1 or 2 or 3 to 4 is that if you are manually tracking how often your clients are coming in, you could have problems profitability-wise if you're not tracking those services and really understanding how many times are your clients coming in, and then pricing it might become unaffordable. If a client is visiting you only once or twice a year now, if you tried to price it and say, I'm going to include 4 visits in that plan, and you spread that over 12 months, your monthly cost may be too expensive. You may not get people to sign up. So if most of your clients are coming in once or twice a year, you want to start there. For us, we can track the services and the profitability across 1.7 million wellness plans. We have some clients where we lose money. They probably lose money on me because I come in a lot. But there's other clients who are not coming in as frequently, so the value of multi-unit math, we can afford it. But for a smaller practice, wouldn't recommend going unlimited to start with. The discount percent is just a little bit the same. Ours are discounted right now. The core services like vaccinations are discounted at about 40%, but things like a dental is only discounted at 10%. And part of that is the labor. So with vaccines, the majority of that is in the cost of the actual vaccine for us. The labor is pretty easy. A dental requires additional labor and anesthesia, so we don't want to discount it as heavily. So it really is percent of labor. You want to discount less if it's high labor item.
And I just wanted to add one more thing. When I went to veterinary school and when I taught for years at the University of Minnesota, I always told our students you should never give away your physical exam. You should always charge for the physical exam. When I went to Banfield, I realized what a problem that was. How many people don't get care because of the charge for the physical examination? How many people think about coming in, but because in the United States the average examination is probably $75 now, how many people truly don't come in because of that? And so once you either discount the physical exam or actually just give it away and make it easy for people to come in, remove that barrier to care. Jeannine showed you the figures. It is amazing how much more our wellness plan clients come in than our non-wellness plan clients. That really is the key takeaway, and that's not necessarily intuitive. You may not believe that to be true, but it is amazing just that one barrier to care the exam charge can be.
Buenas tardes, muchas gracias por sus presentaciones que han sido muy claras y concisas. Mi pregunta va relacionada con los seguros de asistencia veterinaria. Querría saber cómo está la situación en Estados Unidos, y si Banfield trabaja con seguros o con alguna compañía o con todas, y si el seguro de asistencia veterinaria complementa o no complementa los planes de bienestar. Gracias.
Yeah. So today, we do not work with insurance companies. The situation in the US is very small percentage of pet owners have insurance. So it's less than 2%. So a very small portion. We are exploring insurance and partnerships with an insurance company to complement our wellness plan as the insurance begins to gain popularity in the United States. But right now we don't offer insurance. We do accept insurance, so if people have insurance, we will process the claims and give them reports to send to the insurance company so people can have insurance and come to Banfield, but we don't have a partnership with anyone at this time. But it's such a small portion of the US population today. In Spain, is it much greater? Yeah, much greater. Yeah.
I want to emphasize what Jeannine said earlier in her lecture. One of the biggest problems with wellness plans is a confusion with insurance. And so it's really important that your teams know how to talk to clients and explain the difference between a wellness plan and insurance, and that you give your clients written material or you have material on your website that differentiates insurance from wellness. Because that makes people very upset when they think they're buying, when they bought a wellness plan, but they think they're buying insurance. So that's not a small issue. It's one of the reasons why we haven't done insurance till now. We wanted to get wellness right. And we figured once we get wellness right, then we may be able to do insurance and wellness. But right now it's hard enough just to explain the difference. So we stayed away from insurance ourselves.
Hola, buenas tardes. Quería que me contaran si cómo manejan los incentivos con los equipos por la venta de los planes de bienestar. Si utilizan los incentivos y cómo los manejan con el equipo auxiliar, sobre todo.
You know, it's funny. When I started at Banfield, we incented our team members. So our paraprofessionals, basically, we had a set fee. It was $15 per plan, and the last 3 people who talked to the client got, $5 each. We've removed it. What we actually found is it was incenting the wrong behavior. So by incenting the team members to sell a wellness plan, they didn't really believe in the wellness plan, and they just sold them to the client. And we had really bad retention. So our clients didn't stay on the plans. They tended not to have, used the services, and they didn't like the plans. So their satisfaction with the plans was very low. So we actually removed the incentive and said, this is your job. Part of your job is we are a preventive care practice, and part of your job is talking to your clients about preventive care and believing in wellness. And if that's not a good fit for you, you may not be a good fit at Banfield. So we have them, it's part of their mindset. And I'll tell you, we were so nervous when we took the incentive away, and we had much better acceptance. It actually improved the enrollment rate versus declining it.
Hola, buenas tardes. 2 preguntitas. Cuando hacen un plan de bienestar, ¿informan de todas las coberturas de cada uno de los servicios con el porcentaje de descuento y el precio del servicio, o solamente el porcentaje de ahorro?
I see her talking, but nothing is happening.
Yes.
Informan del costo, cuando hacen un plan de salud, informan del costo del servicio aparte del porcentaje de ahorro de cada una de las coberturas. Y segunda pregunta, ¿estos planes de salud se lo entregan abiertamente por escrito o en la web a los clientes o queda como información interna del hospital?
So they, I think I got it. So we do have all of the prices for the services outside of the wellness plan. So we have a tool for our hospital so they can see this is how much it would cost if you got the services today. Here's how much it would cost with a wellness plan. So they use that as a tool for communicating with the client. So we do show both the price inside and outside the wellness plan. The wellness plans are for the client. They're not just a tool inside the hospital, so they are sold to the client. So not all of our clients are on plans. Does that answer part of? Yeah.
Yep, there was the written part. So, the wellness plan is a contract with the client. So we actually have all the material that describes, what the wellness plan is and what the wellness plan isn't, and we give that to the client. We try to explain that to every new client, and the client actually signs that they've understood what we've talked about. So I think that was your question, is it in writing? So it is in writing to the client.
But before to sign the plan,
Yeah, but what we hope is that our teams will explain the plan, and so before they actually get the plan, that they'll sign, that they'll sign it. But certainly some take it home and they read it and they share it with their families, and then they, we actually have a system where we call them if they haven't gotten the plan in the hospital. We call them a few days later and ask them, do you understand it? Have you read the material? Would you like to sign up now? And that's very effective because, as Jeannine said when she was talking, it's hard to, take all this in when you're in the hospital. And sometimes, it's better just to let a few days go by and give people who didn't sign up in the hospital some time to think about it.
And we do follow up with an email to the client or a direct mail that communicates thank you for enrolling in your wellness plan and kind of hits the highlights of what they signed up for in case the communicate. And if you have any questions, call this number. So they can call and talk to somebody if they go, I didn't realize what I signed up for. And they do have 60 days. If they signed up and they want to cancel, they can cancel the plan without penalty if they didn't really, if somebody sold them the plan and they didn't understand what they were buying. So we do let them go home if they have buyer's remorse. But the email is very critical to helping reinforce the education because it doesn't always happen in the hospital.
Buenas tardes, Jeannine. Buenas tardes, Jeff. Gracias por vuestra charla. Vamos a ver, entiendo que vuestros planes de salud también contemplan que un animal tenga una fractura o que tenga una neumonía y, por tanto, esté contemplado asistirle con un coste anual. ¿Es cierto? Porque aquí, en España al menos, una cosa es el plan de salud y otra cosa es que el animal tiene una incidencia y ha de ser atendido.
No, our health plans only include the preventive care services. They do include diagnostics, so there can be lab work and blood work. But if a pet has a fracture or an injury or an illness, that is not covered by the plan, so that they get a discount. We have wellness plan customers receive a discount on services outside of their wellness plan of about 10%. So they would get a 10% discount on those services, but they would need to pay for those services that day. It's not spread over the full year.
Bueno, ahora aclarado este tema, lo que quiero saber es cómo gestionan los pacientes y clientes que son conflictivos, es decir, un animal que tiene una patología que sabemos que va a venir a la consulta con más frecuencia para ofrecerle un plan de salud, porque este paciente con algún problema va a originar unas visitas múltiples. ¿Cómo gestionan a ese cliente?
So we have multiple levels of our wellness plan. So if it is a pet who has maybe chronic disease, first of all, you can enroll on the basic plan that just covers your vaccines and no dental, and you can easily upgrade your plan to the higher levels. If we have a client that has a pet that is significant issues and needs more blood work, there is the highest level plan, which is called a special care, which tends to be more appropriate for those pets that may need more blood work. So it gets 3 blood works a year instead of 1, an additional diagnostic. But again, it is only covers the preventive care, not the actual sick pet care. But they do receive a bigger discount. So if you're on the special care plan, all services outside of the plan are discounted at 20% versus 10%. So they save money that way.
And I would just say, I mean, there are lots of details about the plan that, it's hard to talk about all the details and probably hard for you to remember. If you go to www.banfield.com, you can view all the different plans, everything that's included in each plan, and get a really good sense as to what those plans look like. www.banfield.com. That's my plug.
That's right. And there is a significant portion of the website that is translated in Spanish for our hospital in Mexico, so much of it you can download in Spanish.
Una pregunta es, ¿qué riesgo hay de que los pacientes, los clientes que contraten los planes sean precisamente los clientes que iban a venir de cualquier cosa porque son los buenos clientes, vamos a decir? Y en cualquier caso iban a venir.
Well, I mean, that's, I think it is our good clients who get the wellness plans. There's no doubt about it. But I think even good veterinary clients stop coming to the veterinarian or don't come to the veterinarian as frequently as they should. So the question is, how often should a good client come to a veterinarian? And I think, again, what we found is, and I'll repeat it again, our wellness plan clients come in much more frequently than our non-wellness plan clients. And I think we have non-wellness plan clients who are good clients as well. But being on that wellness plan, having that package of services, knowing that every 6 months I'm supposed to come in, and I can come in between if I need to, makes a big difference, even for your best clients.
Yeah, and I think what I would say is your best clients are going to spend even more money outside of the wellness plan. So within our wellness plan customers, we have 4 tiers of wellness plan customers. The numbers I showed with 4 visits a year, that's an average. Your best customers, which would be me and probably Jeffrey, we come in 5, 6, 7 times a year, and some of those wellness plan customers just come in the 2 times or even once per year. So there are tiers within there. That's why for me, when you start with a wellness plan, you don't want to discount them too deeply until you understand the economics of them, right? So 10% is probably as deep as you would want to go to begin a wellness plan. But I will tell you, there's 4 tiers within the wellness plan, and those very best wellness plan customers spend an awful lot of money with Banfield, and more than they did prior. So we can track clients that were wellness plan customers and what they did before, and there's a significant increase in spend when they join the wellness plan, even if they were already a good and loyal customer.
And I will just emphasize the number that Jeannine said again. It's an amazing number. 80% of the revenue of Banfield comes from wellness plan clients, either within the plan or outside the plan. And so we've turned a lot of clients who might not be good clients into good clients, and they're coming in frequently.
And I think the key statistic there is only 40% of that comes from inside the plan. So even if it was discounted, if that's all your best customers were spending, they're still spending now another 60% outside the plan. So it definitely does increase.